Hey guys, this is FixerMed. Welcome back to my high-yield immunology review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering the entire discipline of immunology in a comprehensive but high-yield manner. This will be part 19 of my multi-part video series of doing so. Today, we will be taking a look at a broad overview of immunodeficiencies you will encounter on these exams. Without any further delay, let's go ahead and get started on today's content. First, let's take a look at severe combined immunodeficiency, also known as CID. X-linked recessive type most common, usually due to common gamma chain mutation or IL-2 receptor mutation. Autosomal recessive type less common due to adenosine deaminase, ADA deficiency. Combined T and B cell deficiency, presents with infections of various types since birth. Treatment, bone marrow transplant. All right, moving on to the next immunodeficiency. Next, let's take a look at Bruton X-linked agammaglobulinemia, also known as XLA, usually X-linked recessive, caused by Bruton tyrosine kinase mutation. Isolated B-cell deficiency, presents with bacterial infections since 6 months of age. Treatment, monthly immunoglobulin infusion. Moving on. Next, let's take a look at IgA deficiency, most common hereditary immunodeficiency, presents with recurrent sinopulmonary infections, associated with atopy and autoimmune diseases. Diagnosis often includes false negative celiac antibody screen. Treatment, deficiency of mucosal immunoglobulin. Moving on. Next, let's take a look at DiGeorge syndrome, T-cell deficiency caused by 22q11 deletion. Absent thymic shadow, presents with hypocalcemia and cardiac anomalies. Normal antibody levels. Moving on. Next, let's take a look at chronic mucocutaneous candidiasis, T-cell dysfunction, presents with recurrent candidal skin infections since birth. Associated with autoimmune diseases. Diagnosis, deficiency of cell-mediated immunity. Moving on. Next, let's take a look at chronic granulomatous disease, also known as CGD, X-linked recessive, recurrent infections with catalase, plus organisms. Diagnosis, dihydrorhodamine test. Myeloperoxidase, MPO, deficiency, last enzyme in respiratory burst, presents with Staph aureus and Candida infections. Moving on. Next, let's take a look at Wiskott-Aldrich syndrome, X-linked recessive T-cell cytoskeletal dysfunction, triad of immunodeficiency, eczematoid skin lesions, thrombocytopenia. Diagnosis, deficiency of cell-mediated immunity. Moving on. Next, let's take a look at leukocyte adhesion deficiency, also known as LAD, deficiency of CD18/LFA1 integrin, presents with decreased leukocyte migration and delayed umbilical cord separation. Moving on. Next, let's take a look at Chidiac-Higashi syndrome, phagolysosmal fusion disorder, presents with partial albinism and giant granules and phagocytes. Moving on. Next, let's take a look at ataxia telangiectasia, failure of DNA break repair, presents with ataxia telangiectasias and increased risk of leukemia lymphoma. Moving on. Next, let's take a look at hyper-IgM syndrome, deficiency of CD40L on CD4 plus T cells, presents with elevated IgM and inability to switch antibody classes. Moving on. Next, let's take a look at hyper-IgE syndrome, also known as Job syndrome. STAT3 mutation presents with facial abnormalities, abscesses, retained primary teeth, and eczematoid lesions. Next, let's take a look at IL-12 receptor deficiency, recurrent TB infections, inability to activate the 1CD4 plus T cells. Moving on. Next, let's take a look at common variable immunodeficiency, also known as CVID, defective maturation into plasma cells, presents with recurrent sinopulmonary infections. Moving on. Next, let's take a look at terminal complement deficiency, deficiency of C5 to C9 complement proteins, recurrent Neisseria infections. Diagnosis may vary, often terminal complement deficiency or complement-mediated immunodeficiency. Moving on. All right, guys, that's all I have for this video today. We'll incorporate these concepts into question sets in future videos, so stay tuned for that. Thought it was appropriate to just stop the video here for today. If you guys have any questions, comments, or concerns, be sure to list them down below in the comment section. If not, this is FixerMed signing off. Be sure to have a great day and good luck studying.